It's 4 o'clock. I think we should begin. And I want to welcome everyone for the African Tea Time presentation. And for the people joining us for the very first time, we really wish to welcome you and hope that you're going to enjoy. And feel free, because this is a meeting, feel free to add your question in the chat or wait until the end of the presentations for you to verbally ask your question. So both chats and verbal communications are allowed. And for the presenters who are joining us today, we thank you so much for sparing your time to be here. So first, I'd like to do some introductions. I'll begin with myself. I'm Damaris Joti. I'm assistant to the director of the African Studies Center. And the Kongamano student group with the African Studies Center are the hosts of this African Tea Time. And it happens bi-weekly, usually. But the Thursdays, especially the next one, the next two coming tea times are going to be consecutive. That's November 5th and November 12th because of the upcoming Thanksgiving. But usually it's supposed to be bi-weekly. So just for you to know that, and I know that is going to go out through the flyer as well. And I want to give this time to Sarah Davis, who is the representative of Kongamano, the student group that works with us, to introduce herself and say something.
Hi, I'm Sarah, and I do the social media and outreach for Congamano. And like Damaris said, we're a student organization that focuses on Africa, and we host things like Tea Time and uh, Taste of Africa and different events in collaboration with different student organizations and the African Study Center. And we're always looking for new members that are students and faculty and staff and not. We're open to the public. We obviously focus on Lansing because that's where we're located, but we love to collaborate with different organizations. So please feel welcome to come to more meetings and join if you'd like.
Thank you so much, Sarah. And we have three facilitators. I keep repeating this every tea time because we have new members joining in. So we have three facilitators for tea time events. We have Ebenezer Ansah here, who is going to facilitate our discussion today. And the two others, Dr. Jorema Awadu and Dr. Mdumba, both might be joining us later, but I just wanted to mention them because you'll be seeing them all the time during the tea times. So at this time, I want to welcome Ebenezer to introduce himself and continue the conversation. Thank you so much for coming again.
All right, thank you very much, Damaris, and thanks to everyone who has joined us today for tea time. As Damaris said, my name is Ebenezer Ansah. I am a student in the Department of Community Sustainability, a PhD candidate. I've been with MSU since 2014. I'm originally from Ghana, and I love Africa and I love the people of Africa. And so when I came to MSU, I found myself in the African community, and I have been part of Kongamano. That's the group that we've been talking about as the host of this African Tea Time and other events. African Tea Time in particular is meant to help faculty, staff, and students of Michigan State University and other people in the community to learn more about Africa. So basically, before COVID, what we used to do on campus is that we bring students and other people from the various African countries to come and talk about their countries. And that through those first-hand experiences of those individuals from the various African countries, we share and then we learn about life and everything that happens on the African continent. And that is what we have continued in this virtual space because of the COVID-19 pandemic. And so since we started the virtual space, we have continued with the trend that we use. Every day we focus on two African countries, and then we share and learn about those African countries. for today, we are focusing on Madagascar and Senegal. And the theme that we have chosen for Madagascar and Senegal is around Africa's response to the COVID-19 pandemic. And we thought of this topic for these two countries because of some of the interesting things that have come out of Madagascar and Senegal with regards to the COVID-19 pandemic. And so I wouldn't want to go too much into what it is that the presenters will talk about with regards to COVID-19 in Madagascar and Senegal. So without wasting much time, I would go to our first presenter, that's Narindra, who is representing Madagascar. And for Madagascar in particular, the talk would focus primarily on herbal remedy that was promoted by the president of Madagascar. So Narindra, without wasting much time, let me give the mic to you and then take a minute or two to introduce yourself and tell us more about yourself, and then you can go into your presentation.
Thank you so much. Hello, everyone. My name is Narindra. I'm a senior at Michigan State University, and I study biosystems engineering. I am from Madagascar, and today I'm going to talk to you about the traditional remedy of COVID-19 that was launched in Madagascar. So I'm going to share my screen. I cannot share my screen.
You cannot? Oh, I will. Or Nicole?
Do you need permission to share your screen?
Yeah, the host say disable.
Okay, let's see. Why am I not seeing the... Hello, Nicole? Nicole?
Yeah, you didn't hear me say I'm working on it. I kept, every time I hit participants, it kept coming up with the chat. So I finally got it. She should be good.
Okay, thank you.
Thank you. Okay, so as mentioned earlier, the theme for this week is resources and remedies for COVID-19 in Africa. And for the particular case of Madagascar, I'm going to do a short presentation about the COVID organics. That's the name of the herbal remedy that was launched in Madagascar. So I've mentioned this already about myself. So before we talk about the topic, let me show you a little bit about Madagascar. So Madagascar is in East Africa. It's an island with about 27 million population, and about 60%, more than 60% of Malagasy population uses traditional medicine. So this is a general overview of what we're going to talk about today. So we're going to talk about what the COVID organics is, its impact on addressing the COVID-19 Madagascar, and different opinions around it. And at the end, we're going to have a short discussion about the traditional medicine in general in Africa. So COVID organics, it's a herbal tea promoted by the president of Madagascar in April 2020 as a remedy to prevent and cure for COVID-19. It's based on Artemesia annua, the plant shown on the right, and it's processed by the Malagasy Institute of Applied Research in Madagascar. In April 2020, the president announced that 20 trials were done, and from that time, the herbal tea was distributed across the country and to different schools. A little bit of background on Artemesia. So Artemesia originated from northwestern Asia, mostly in China, and it was introduced in Madagascar in 1970s to treat malaria. In 2001, the World Health Organization recommended the use of Artemisian-based compounds to treat malaria. So the COVID organics and its impact on addressing the COVID-19 in Madagascar. So in August this year, the president of Madagascar made a statement that if there was no COVID organics, CVO, that's the abbreviation, there would have been more deaths in the country. So from the president's perspective, the COVID organics definitely impact in a positive way the the um, the approach to address COVID-19 in the country. In addition, several people claim that the traditional remedy cured themselves. For example, there is this famous singer in Madagascar, Dance Man. Um, she did she did an interview about how she got cured when she used the tea, the herbal tea, COVID organics. However, in toward the end of June until August, there were spikes in COVID-19 cases in Madagascar, and that caught a lot of attention in the media because the number of cases rose a lot, and one of the reason uh, that could have been is that when the herbal tea was distributed across the country, some people consider themselves safe, and they participated in large um, gatherings activities. However, with the COVID organics herbal tea, it works for some people, but not for everyone. So here are different opinions about the herbal tea. So at the national level, some of the people who accept and use the tea say that it's just a tea. So if there were any side effects, it wouldn't be significant because it's just like any other tea. For some people who does not use the tea, they are concerned about the efficacy of the of the remedy, the dosage as well, and the fact that there hasn't been much scientific evidence about the cure. So I mentioned here there is not much data available yet, but from our observation, meaning from media and people expressing their opinion, um, a large number of population in Madagascar uses the remedy. Uh, the rest of the world, some countries in Africa express their opinion as this herbal remedy as an African pride, as it's like something good coming out of Africa, which is a good thing because from my observation, traditional medicine hasn't been really accepted anywhere else outside Africa. So I think like other countries acknowledging the approach is a good in a way. Some other African countries use the remedy as well, including Senegal, Comoro, Guinea-Bissau, Equatorial Guinea, Democratic Republic of Congo, Liberia, Niger, Tanzania, Nigeria, and Chad. Um, However, the rest of the world still have big concerns about the efficacy of the remedy and the fact that there hasn't been much clinical trial done with herbal tea. So just like to talk a little bit about like traditional medicine in general in Africa. So according to the World Health Organization, about 87% of population in Africa uses traditional medicine. For Malagasy people, for example, in this scenario, they use um, the COVID organics herbal tea with infusion with some aromatic plants to as like a preventive way for the COVID-19. And some people say that it works fine, um, but again, there hasn't been much data collected on it. So I think that's one of the major problems because it works on some people, on many people, but the fact that there hasn't been data collected on it, then that contributes to the rejection of the traditional medicine in Africa. So just like some questions for us to think of is that why is that traditional medicine is not as widely accepted as modern medicine, and what do you think we should be done about it? So here is a summary of what I just talked about. So COVID-19 is definitely a current major problem facing almost all countries in the world, with more than 41 million cases up to this time and more than 1 million deaths. This shows that this is a serious problem, and each country is doing their best on their own way to address it. So in case of Madagascar, the use of COVID organics herbal tea is the approach that is available. That's available at that's available for the population. It works for some people, but not for everyone. And as I mentioned before, there more evidence on the efficacy of the herbal tea is needed. And that's it. My presentation is finished.
All right. Thank you very much, Narindra. That was a very great one, precise and concise. We very much appreciate your time and the knowledge that you've shared with us with regards to the COVID organic. That's the herbal tea that came out of the Madagascar Institute of Research. Pardon me, audience, that I forgot to mention that after Narindra's presentation, we'll go to the next presentation. And then when we are done with both presentations, we'll come for questions and comments and discussions. So at this time, I will turn to Aminata to share with us from the perspective of Senegal, some of the measures taken by the Senegalese government and some initiatives from the citizens themselves with regards to COVID-19. So Aminata, I give you the mic. You take a minute or two to tell us a bit about yourself, and then you go into your presentation.
Sorry, my mic was on mute. Thank you very much for having me. It's really a pleasure to be here tonight. My name is Aminata Niang. I'm a Senegalese woman. I'm a cultural anthropologist. I did first my college in sociology here in Senegal. Then I worked here for almost 10 years. Then I decided to go do my PhD at the University of Arizona, where I graduated in anthropology. And then I came back in Senegal in 2012. And then because I thought I really have, there's so much thing to be done here and I need to come back here. And I worked as research at IPAR. IPAR is Initiative Prospective Agricole and Rural. It's a leading West African think tank working on many issues, SDGs, rural development, youth employment, women economic empowerment, rural
Looks like we lost Aminata for a second.
I thought it was my internet that was.
Okay.
Okay. I think we have it back.
Oh.
I'll try to share my screen now. Just one sec. Can you see? Is it working?
Not yet.
Not yet.
Okay, so let's wait then. Let me know if you can.
Did you select which screen you wanted to share when you hit share your screen? Because we're not seeing anything.
Oh, I just, sorry. This one.
Yeah,
You see it now?
Yes.
Yeah.
Got it. Okay, thank you. So I'll be discussing the case of Senegal, which is, as you already know, a small West African, Francophone West African country. So I'll be just first go over, do a brief overview of the economic, social, environmental, and demographic situation, then discuss how did we manage
We lost her.
Did we lose Aminata again?
Yeah.
how did we
Aminata, if you are back, I think we lost you for a second, so your screen went off.
Can you see now?
All right.
I don't know what's
Yes,
going
we
on.
can
I'm
see
sorry.
it
Maybe
now
that's
and we can hear you.
sometimes since this morning I have issues with the internet connection. So hopefully things is okay now.
Yeah, we see you. And
You can, okay, good. So as for the background, Senegal is a small, peaceful compared to the other African countries. So in terms of conflict and war, we so far, we don't have these issues, and it's a democratic country. All the elections have been peacefully, peacefully held, and the country is currently led by President Macky Sall. It's a we have multi-ethnic group in Senegal, more than the main one. We have four main one: the Wolof, the Fulani, the Sere, the Jola, and the Bambara, and we all live peacefully in the country. It's also a country where Islam, Christianism, and and other religion also share together with no problem. Our economy rests mainly on agriculture, tourism, fishing, mainly for export, and services, banking, online banking, mobile money, and other services. Senegal is considered among the top 10 African economies, the GDP around 6-7% per year since 2012. But now we have a poverty rate of 37.8%. And these are new statistics. We did a recent survey by ANSD, our National Statistic Bureau. So this the poverty rate has increased lately due to COVID, and this is a new survey that just came out. And the youth unemployment is also a big issue because we have rather a young population. Currently, we have around 16 million people, and then it is expected to reach almost 20 in 5 years. The population, the young people make around 42%, and female, also the women are around 52%. Senegal is now characterized by rapid urbanization due to rural exodus, decline of agriculture, and then also a lot of immigration from the neighboring country. And then we have a fragile health system as many other African countries. And so given this context, we, Senegal, managed really to put under control COVID-19. We have the first case back to March 2nd, and it was an imported case from France. So to date, as the date today, 20% are confirmed cases, and then yes, and few like 5 are really in intensive care. Overall, since March 2nd, we have 15,000, more than 15,000 confirmed cases. 14,000 cases are treated and healed, and we have 321 people who have died of COVID. And then currently 1,160 persons are still hospitalized. As other compared to other countries also, the COVID has impacted really the economy badly, the transportation, education, also agriculture, and then food security, because with the lockdown, most of the food are produced in rural areas, so there's a problem of bringing the food back to Dakar. So we have some food security. Fortunately, we have the government have put in place some strategies to to ease access of food for the community. I can't use, sorry, my are frozen right now. Hello?
Hear you now. Yeah, we can hear you.
My screen just, I can't move to the next slide. I'm so sorry. Let me just stop for one second,
No,
the sharing, and then see what's going on.
Sure.
Yeah.
That's fine.
Can you see now?
Yes.
Yep.
Are you able to do a full screen? Like hit the full screen?
Yeah, this is what I'm trying. Okay. This.
Yeah, it's working.
So yeah. So people are saying we Senegal is not considered as a success story when it comes to handling the disease. But in the first place, let me tell you, we have our biggest fear was how in the world will be we're going to be handling this disease, that the mode of transmission is through respiratory, in a context where we one of our cultural traits is social proximity. I mean, we share food, as many other African, we share food, we have to eat together, as you see in the picture on my left. We have to eat together in families. The transportations are packed. The open market, so people are just close to each other. And then the youth, there was another concern also. They have to be out. They have to be out. They have to play soccer. They have to just to be sitting on the street. So how in the world we gonna be observing of physical distancing in this context? We have the culture of shaking hand. Otherwise, as if you don't hold hand, shake hand, they might see as you are not respecting, the other. We have, to be very close. So this was really our big fear. This and plus our weak health system. Overall, in Senegal, we have around 30 hospital bed with ventilator, 30, and within a population of 16 million and one doctor per around 100,000 population. But we have to manage that. The government actually have shown a strong will since the beginning of this of the disease. And really from the president to the local mayor, people came together really to put together efforts and to really discuss and see how we're gonna together handle this. And strong preventive measures were, the government set those preventive measures in the beginning. We went through partial lockdown, state of emergency, curfew from 8 p.m. to 5 p.m. To 6 a.m. in the first place. And then it was very hard. We kind of eased the curfew. And also there were no traveling between the regions and between some cities. So this has impacted what I was saying, food security in agriculture, which most of the people rely on. Also, there were another strategy is the obligatory precaution measures in public space, in the offices, in public services, and even in private bureaus, in transportation. So you have to wear a mask and observe, and physical distance yourself physically from the others. And washing hands. So they were putting a spot to wash hands everywhere in the market, in the schools, everywhere. So we can see this. And then there was also mass communication really around how people can catch the disease. The artists, the influencer, all people were, came together on the TV, radio, and just to sort of raise awareness around how you're going to get these and how to avoid that. So, and this has really worked. Plus the government, the government had put together an economic and social resilient program and a solidarity fund worth of milliard, I think it's around 5 billion, 5 million in US dollars to purchase food, so you can distribute those food to remote area, to everyone actually have received, not everyone, but most of around 1 million households have received food aid, rice and milk, oil, those basic food. And also support the small producers and other sector that mostly affected by mining, such as the tourism sector, the hotels mostly. There's something also important that the government also, the local medical authorities have able to do is to a good tracing and testing, massive testing. Every day we were testing about 1,000 people were tested, and also we're tracing the contact cases. And then those people, the people that are suspected case were put in hotels, and the government has to pay per person 50,000 francs CFA. I think it's around $100 per day for those people who are put in big hotels in Dakar. So they were not at the hospital. They were treated over there, and the serious case were taken to the hospital. So that was a good strategy. Another one is we have the medical care, and usually free for most of it, were really were excellent, and which results of a high cure rate for the patient. Now, they were not only the government who were doing these efforts. Yeah, the rest of the rest of the society, the country actually, some civil society organizations, the private sector, donors, also, and even local authority, just regular people who can afford. They also bring in money, a lot of money. I don't have right now the exact amount, but millions were raised, so they to help fight this pandemic. It was the first time that we really witnessed this. I think this was our trauma, like Rwanda had this trauma, the other country, but Senegal, we really never, this was sort of a fear of a trauma. I said, this time we have really to come together as one to fight this. And it was really a pivotal moment that has helped a lot. And then, I'm gonna, because my lot of things to say, I'll go very quick. We have, as social scientists, we gathered around a task force. We call it empathy. And then I was part of this, and then other sociologists, medical anthropologists, public health experts. We said, this pandemic, the solution won't be only a medical one. We need to put in place community strategy. We need to engage everyone in order to find this. This is what we did when we are with HIV/AIDS. Community engagement helped a lot to really reduce the spread of HIV, and then it was the same. So then we decided with our own resources, we were meeting, and then we said, okay, how we develop a strategy to support the sanitary district. We were going on the field and engage stakeholders, to how we're going to help them. How we're going to co-construct solution with community. For instance, we mobilized our women group. They're very powerful. They have a lot of members, and then we know they're very engaged. We said, look, we need your help. We have to go on the markets, the household, the gathering, and help us spread the word. The COVID is here. It's dangerous. Follow we need to respect the preventive measure, and it worked. And then it was very simple. I can give an example. It was during the Ramadan. Usually, I think I've seen some Senegalese women here in the conversation. Maybe they might better understand what I'm saying. During the Ramadan, usually women, we have to cook food and bring it to our in-laws. And this time we said, we're not going to do that. We have to buy hand sanitizers, buy some masks. Rather than cooking food and bringing them, offer those things to your in-laws, to your neighbors. So people, those were local solutions that works. And then people also were, if you know that your neighbor has not much means, go help their neighbors, give him masks, give him hand sanitizer. So those kind of things have worked. And also, I apologize again. Sorry, I have issues with my computer today.
No worries, take it easy.
Yes, I can. Let me share again this. Yes. Oh, sorry. Okay, here. Um, so the community engagement, but when you put this one help a lot. I don't know what's going on with my computer. I apologize again. So it really helped to take some relevant action to fight, for instance, stigmatization. You know, in Africa, like when even in Ebola, we did that in Guinea. People were because of the fear of stigmatization, they're afraid of going to the sanitary district and say I have the COVID. So because they're afraid of being stigmatized, it's the family that brought us COVID. So we were fighting against stigmatization, and then and help them really know this is a normal disease. You find, go get some help. And then we also train volunteers, students, really to go on the street, the markets, transportation places, and do the awareness. And this is few pictures, little youth, women, and even elderly who are at the forefront. And here you can see a young student, wearing. We gave them these shirts so they can go and share some sanitizer, try to keep the distance. Here you can see a lady at a shop. People were buying. It was a Ramadan period. People were buying bread. So she was saying, keep your distance, 1 meter, stay, don't get close, wear your mask. So they were really there. And then here, even the elderly people, we did a sort of a group discussion at a school, try to engage, religious leaders, local leaders, how they really also do their part, go to the mosque and do the work also. And then we were discussing around the cultural values, empathy, social solidarity, to help people understand better and help others. So, so from this experience of pandemic, I think you can see this. We have learned a lot. So, like in Senegal, we rely 80% of the food we consuming is from abroad, and with the lockdown, people have really suffered. It has increased food insecurity. So I think the government has understood now we need to really foster the promotion of a durable food system and encourage use of local product. This is really what we have learned, and I think we're going forward of implementing, or at least building ideas around this, how to really improve our food system, and also strengthen the existing safety net by broadening access to social protection mechanism to help the most vulnerable population, mostly women, rural women, people with disability, etc., the elderly. Also, there's an urgent need to develop health system and pharmaceutical industry. But right now, people are getting sick, and there's a shortage of many basic pharmaceutical medicine, even over-the-counter medicine. Also, we understood that this kind of pandemic, hang on just 1 sec. This kind of pandemic, we need to really engage communities. We need to listen to them. They have things to say. They can provide some solutions and really empower them. And finally, this pandemic has offered many opportunity for creativity and innovation, and we have seen that every around the world. Like we're using Zoom, as a mean of communicating. In Senegal, there's some bright young scientists who have invented some local they use, raw material, local material to create hand washing system, to create hand soap based on these local products. And then, so and this has to be really documented for future, for knowledge management products, and then how we really encourage this kind of creativity in this time, in this crisis. And finally, there were just few images of the beautiful port side of Senegal. Well, there are many other things that I can say, but I think I have much. The 20 minutes were long gone. Thank you for listening to me, and sorry for the technical difficulties. Thank you.
Thank you very much, Aminata. No worries about time and those difficulties, we understand. Thank you very much for the time and the knowledge you shared with us. And I mean, from the two presentations we've just had, it kind of goes without saying the things that have brought Africa to this point where ourselves and probably people outside of us are surprised the extent to which COVID-19 has been able to find a fit in Africa. Thinking of herbal remedies and the things that you talk about in your presentation, Aminata, these are ways of life in Africa that I believe we are accustomed to, we are used to, and these have helped us a lot. So I'm sure that the discussions and the conversations following the presentation are definitely going to go along those lines. So before I throw it out there, let me first of all ask a few questions to get us into the discussions and the conversations. In particular, you made a very important point, Aminata, in your presentation with regards to how the Senegalese government used hotels as a place for treatment. And I was curious and I wanted you to throw a bit more light on that. So were those people that are being treated in hotels, are those travelers, are such people that were picked from the airport and got tested and they were positive and so they were kept in those hotels? Or were the hotels actually selected to serve as pseudo hospitals such that they would be used to treat cases that are not so serious? And then also for Narindra, in your introduction, you talked about how about 60% of the people of Madagascar already use traditional medicine. And I was curious because, I mean, we use traditional medicine all over Africa, but it would be interesting if 60% of the people of Madagascar use traditional medicine as their primary source of healthcare. So I was curious about that, and I'll be happy if you could throw some more light on that too. Thank you very much.
Can we answer now?
Yeah, sure. I mean, any of you can go first, and then after that, then we can go to the general discussions.
Okay. Regarding how people were actually kept in the hospital, in the beginning, the government actually has requested the big hotel for three of them, the biggest one that can contain more than 200 people. This is an emergency situation, so there's no tourism. We need your hotel so we can place in people, the contacted case. So this is first, and they have to agree because there was a state of emergency. But the government in return will give them, will actually pay them with a huge lot of money. So these people were, they provided, food and everything, and then also the medical care also they were there, and people who are now, and they were tested every 3 days. These people were tested, and the ones that have now positively tested were taken to the hospital where the the COVID patient are being treated. So this is by I think few weeks later, there was sort of some difficulties, of course, because from hotel they were complaining already that the patient are destroying they were destroying the furniture, and they were complaining, and they were, of course there are many difficulties, but I think it has helped a lot the government to trace. And then the people who were coming from abroad before we completely shut down the how do you call it again, the airline transportation. So those people were taken straight to the hotel, and also there was a hotline in a toll-free number. So when you call, they have the sign, the symptoms, they will come and get you and take to the hotel. Yes, this is how it worked.
Nice, it's interesting. Narindra, do you want to take that question now?
Yeah, regarding the use of traditional medicine in Madagascar. So as I mentioned during my presentation, more than 60% of the population in Madagascar uses traditional medicine, and but it doesn't necessarily mean that they only use traditional medicine for their healthcare treatment, but it's just like mostly for the common illnesses such as fever, some kind of inflammation, and things like that. According to some studies, like a large percent of the flora in Madagascar are medicinal plants. I don't have the exact number of species, but about 35% of those medicinal plants in Madagascar are endemic. So it's like people have been used to using those, and when the president launched this COVID organics herbal medicine, some people just like went for it because it's like something that they're used to. Some politicians have other opinions about it, that it has been politicized, that if someone else, not the president, promoted the product, then the outcome might have been a little bit different. So I found that was pretty interesting. Yeah.
Great, thanks for sharing that. That's very interesting to note. So let me go to the chat section. There are some questions there. So first of all, and I think I'll throw this one to Aminata, because you have personally been involved in the fight in your own way in Senegal, and maybe to some other persons in the audience who have been probably in the front line. So the question is that in the fight, of course, are there any health and human services that need to be improved? If so, what are those disparities, and how can the diaspora help to mitigate those health problems? So I think I'll throw this to Aminata in particular, and maybe any other person in the audience that has some experience or has been involved in the fight and have realized some of these difficulties in our health system.
Thank you. I think it's a great question. I think from experience, beside on what I was doing on the field, I've been also visiting the hospital. My sister has been hospitalized for 2 months due to COVID for another for surgery. So I have to spend like 2 days during the week with her, the rest of the day with information. And I can tell you, the hospital, what we are lacking medical supplies, because you have, right, we are at the almost now all the hospital in Senegal, you have to go buy your own your own medicine. Even if it's an emergency, they have to go. They give you the how do you call it, um, the prescription. The doctor write the prescription. You have to go outside the hospital to get those medicine and come back. Meanwhile, your patient can die, or his her situation can be aggravated. So medical supply and pharmaceutical are really an urgent need. And also just equipment. I was saying overall in Senegal, we don't have more than 40 beds with a ventilator. I think it just, we thank God this didn't go beyond. We didn't have many critical cases. We have many deaths, of course, but we didn't go because those deaths actually was because of lack of those beds, or they coming in late stage of the disease. But for now, medical supply, equipment are most needed, mostly in places where they treat where they treat trauma, trauma, or children at the children hospitals also they need. So for the other question, that the diaspora really can help by maybe spending some medical supply, sending stuff for children. I've been to the United States. I have children over there. I know the hospital and the children ward, they have toys, they have some, some quality services that help, people cope with the disease. We don't have this kind of those services over there. Now people are contributing, helping. We have now a new hospital, children hospital at Jamñajo, and some good some people are really making some donation, buying some toys for kids who are there. There's so many children that don't even have parents. So really the diaspora can help by sending in Senegal some medical supply and equipment. Yes, this is what I can say for now. There's as many problems that I maybe can't share for now.
Great. Thanks very much.
Thanks.
I mean, if any other person, Narindra, or any other person in the audience has any views on this, welcome to share them with us. We'll be very, because this is a very important question that needs to be asked with regards to the African COVID situation.
I'll share my experience. I work on a USAID project here at MSU. We're working in Ghana, Kenya, Nigeria, and Bangladesh. And I focus mostly on Kenya. So I work with women at the market and market masters, and I work with farmers and extension service agents. So one of the things that I observed when the COVID situation started, when I started the project, was that when I would call or have video WhatsApp with market masters and market women, they would all be putting on their masks, their water stations. They would be telling their customers to wash their hands. And there was a lot of policing at the market. So there was a lot of adherence to this during the lockdown. But then people pleaded with the government that this therefore forced the president to open the country. But also scientifically, I know the logics behind it. They were going to delay the infection, the numbers went down, and therefore you open the country. Because if you don't open, people start getting tired and they just start getting out of their homes and the infection rates come up. Anyway, so the country was opened up. And what I started seeing at the markets is that people are no longer putting on masks. If they put on the mask, it will be on the chin, but because they feared the market master or the police. Yeah. But then at a certain point, the police were not interested and the market master was not policing them. So then even the water stations were disbanded, there was no sanitizer, and there was laxity. And what has happened now is that in Kenya, there are almost rumors that there's gonna be a second lockdown because our numbers are increasing. So when it comes to food security, the farmers were not able to get, for example, pesticide. So their yields are lower, it's hard to also employ people because they're people who are working for you are more expensive now. The labor is very expensive. The farmers are therefore deciding to reduce their acreage of crop. And therefore, one of the things that we might be foreseeing in most of our African countries is that we might have shortage of food. For my colleagues who are doing their studies in Nigeria, you know what's going on with the Ansah movement, which I think is warranted. Um, but it's also, we've not been able to talk with farmers over there because of what the nation is going through here. So yeah, that's what I'd say on my end about COVID-19 in Kenya. What my market masters and the women were saying is that if these methods of mitigating COVID-19 were to be sustainable, it's better for the government to avail all the logistics for prevention of COVID-19. They should supply the masks, the sanitizers, make sure that the water is there at the water spots. This cannot just be left for the market women or men and the market master to be the one who are supposed to be following through that these amenities are available. Yep, that's what I have to share.
Nice, great. Thanks so much for that experience sharing over there. Any other views on some of the health and human services that need to be improved, particularly with regards to COVID and how we respond to things like that, and maybe how the diaspora can be of help? All right, let me throw this one in quickly, and then maybe we can go to people to ask verbal questions. So with regards to COVID, I've been in Ghana since even before the beginning of COVID. And one of the things that have bothered me from the onset is how information has been given to the people. I believe Africa in particular could have even done much better with regards to our COVID situation if information was managed and handled more appropriately than it was. And this, I think, is not even just with regards to Africa, but I think it's more prominent here. And it has to do in particular with how the problem was communicated as some sort of a short-term problem. I mean, right from the word go, it was obvious that we were going to have to deal with this thing for at least some years. But you look at how the problem was communicated and the measures that were being put in place, the lockdowns and the curfews, blah, blah, blah. Almost everything was portrayed as a short-term measure, and we are going to get through this in the shortest possible time and come back to life as usual. And I think that was the problem. So as you indicated, and people got tired and wanted to get out of their homes because, I mean, you didn't make it look as though we are going to be in our rooms forever. People didn't know that we are going to have to move to a virtual world like we are doing right now. So I think that's one of the aspects of our health and service delivery that needs to be improved a lot with regards to COVID and situations that are similar to what we had to go through. And so I think at this point, if you have questions and you want to ask them, you can come in. There is the hand raise option. If you go to participants down there, after the list of participants, you can see the raise hand. You can use that, and if you raise your hand, I will call you and then you ask your question.
Can I say something? I just come to my mind. Oh, that is my hand.
Sure, go ahead.
Yes, after Narine has presented with the case of Madagascar, I remember there was an anecdote in Senegal. Madagascar has sent us some the COVID organics, like boxes of those bottles. And this the Senegal's medical authority said they're going to test it and see what is the level of efficacy of this remedy. So after weeks, no sign of the medical authority on that remedy, and because she was right about saying it was an Africa pride. We said, thanks God, this is a natural remedy. Africa will really cure the rest of the world. So everyone was really proud of this. And after weeks, no sign of how about the shipment that the Malgache president have sent it? And people start saying, actually, as soon as they received at the airport, the government officials, they shared the stuff. They said they drank the whole thing. That's why there was no alcohol. There was no alcohol. Where are those remedies? And since now, we can't find any of the the sample that they sent, because they were really, So it just come to my mind. I wanted to share that with you guys.
That's interesting. All right, I think I'll go to Philip and then I'll come to Anne.
Yeah, thank you so much. I really have more of a comment, and it's in reference to Narindra's presentation. I loved it a lot. It was very, very reassuring and very practical and down to earth. And I say this because I'm a firm believer in traditional medicine. I'm a firm believer because I've seen it work and I've been treated with traditional medicine. My aunt, my mom's older sister, had all her children except one at home, 5 children, through traditional medical practices. I've seen malaria cured with it. I've seen jiggers removed from someone's toe with traditional medicine. I've seen it used to cure tonsillitis. I have a scar on my hand. My grandfather was I guess you could call him a traditional healer. I have a scar showing treatment for a problem I had with my right arm. I'm not going to show it on the screen, but trust me, it's there. I was also cured when I had measles. It was traditional medicine that was used. So I'm a firm believer in it. And I think perhaps maybe when we talk about solutions, this is the first time someone is suggesting a solution for this problem, at least on the continent, by looking to what we have. This is the first time I'm hearing it on the level that Narindra explained it. And perhaps more attention needs to be placed here. Perhaps this is where the solution is. However, I also think, unfortunately, that part of our colonial legacy is not to trust ourselves or to trust our knowledge and skills. So maybe that is something that we need to reconsider. How do we get to work on our minds so that we can overcome some of those things that have been told us about ourselves? The fact that we're not capable of certain things. Maybe that is something that we can work on somehow, I don't know, but I think it is necessary so that we begin to reclaim what we have and begin to trust ourselves more. But yes, it was reassuring listening to you, Narindra, and the fact that you say 60% of the people rely on it really, when you said that, I was really happy to hear that, because like I said, I have every reason to trust this form of medicine. It has worked for me and I still trust it. So thank you very much.
Yeah, thanks very much, Philip. I have always held that people can deny it as much as they can, but there's no way we can run away from the fact that herbal remedies are part of the reasons why COVID could not have a strong foot in Africa. No one can take that away. And you can go ahead with your comment.
Just 2 comments and then the question. So I'm just adding my voice to Philip and you, Ebenezer, on the issue of the presentation on traditional medicine, because when COVID-19 happened, I started seeing on various WhatsApp groups that I'm in, very Pan-Africanist WhatsApp groups, one where we discuss herbal medicine. I've always done that but now people are really embracing it. And coming from Kenya, and my parents are older people who have bronchitis, and it means they have all these comorbidities. I was worried for them, but what he started seeing is that people are now getting comfortable with having tea that has ginger, eating the bitter vegetables, or using the neem tree. The neem tree, in Kenya, we call it marubaini. It's known to treat 40 diseases. Yeah. So it's hailed for that. So what has come out of COVID-19, I think for a country like Kenya, where at least growing up, people were shied from and rejected traditional medicine, is that now people are getting comfortable with it. Yeah. People especially Christians in Kenya, shun traditional medicine, yeah, as opposed to the Muslims. So, and I'm saying this because I come from a family where we practice both religions. Yeah, I see how my Muslim family embraces it and how my Christian family seems to be jittery about it. Another thing is to just speak to Aminata's presentation. I was so impressed when I saw the Nite Garabam, which is Utu or Ubuntu. And I like the way the Senegalese government or the community relied in this epistemology to develop pathways of mitigating COVID-19. Because sometimes we've got this knowledge or ways of knowing within our communities that can help us organize and humanize our people. But when we don't use them, then we just destroy our people. You know, there's a lot of beating up of people during COVID-19 prevention, some being put in prison, uh, ways of burying our people that scared them. I'm a child of HIV/AIDS era. So for the second time, Kenyans were seeing their relatives being buried in the same style that the first cohort of HIV/AIDS victims would be buried in. In all, they would be bounded and you'd be told not to come for the funeral. There was so much fear around it. So they're being visited upon the same way of just seeing the disease. I could draw a diagram and I'll really plot what was happening in the 80s in Kenya. Especially, I came from a place where HIV/AIDS really just, all of us lost family members and my age group, some of them died of it. So when COVID-19 wreaked havoc in the world, I was seeing this for the second time. You know, I was afraid that, oh my God, we're gonna fall again. So the surprise of Africa has been a hopeful moment for me so far, because I believe that one of the miracles as to why Africans are not dying is because we've had our shares of these diseases and of our problems. Yeah.
All right, thanks very much. And I think, I mean, relating to we've had our shares, if you think of it in the other way, it is also true that having our share have made us more resilient. So we've seen crisis over and over again. So we didn't need to start preparing for it. I think that's an aspect of it too. Before other questions come in, if other people have questions, let me throw this one to Aminata in particular, and maybe if someone else has any knowledge about that. So we had rumors earlier on that Senegal in particular was leading in the science for a vaccine. I don't know if how true that is or that was, and if apart from Senegal, if anyone knows of any efforts in Africa, scientific efforts, I mean, vaccine or any other scientific effort towards the fight against COVID-19.
Okay. Thank you for your question, Ansah. Our testing, how do you call it again? Institute Pasteur, they early on starting working on a possible vaccine, but it costs a lot of money, and then they didn't. I think that they didn't say it like in a public way, but it's a lack of support from the government and the donors. Maybe it's an issue of trust, of funding the some initial development of vaccine, because they have like the testing. This is one of the leading actually institute when it comes to health testing, vaccine development, because it's with France. The headquarters are in France. In Senegal, they're still working on that, but they don't have the means to the money to do that, because most of the money were, because the government decided to care. I mean, the patient of COVID don't have to pay, so there was a lot of a burden for the national budget. So I think now there's no, I don't think they're on the track of developing any vaccine. Besides, now the trend is now diminishing. They have fewer cases, and hopefully it's gonna keep going on like that. So I think they were not interested anymore on developing a vaccine, maybe in the future. But now there's no more any. I have no ideas now if they're still on the path.
Sounds good. Anna, I still see your hand up. Did you want to share
just
something on
about
that?
we're not working on a vaccine in Kenya per se, but Oxford University through Lancet has been carrying out testings of the vaccine trials in Kenya, and now they're on their third trial. Clearly, it's very political because people are very uncomfortable with these testings being done on African bodies. Yeah, but they are going on. Yeah.
Okay, Eben, I just wanted to.
It's good to know.
Oh, okay, I can.
Sure, go ahead.
Yeah, it's because I don't have the raise hand feature because I'm the host. I've been waiting to take a turn. But anyway, first I'd like to thank both presenters. This has been very enlightening, because when you are thinking of having this discussion, all the things that you've actually touched on were in mind. We're trying to, the big question in the planning committee was, why is Africa not actually impacted much compared to other countries? That was the big question that drove us thinking towards this conversation. And I know there are many more theories out there yet, but I am happy with the way you've really put it out there clear that regardless of anything, starting with Aminata, your government tried. I mean, they followed the mitigation practices and policies, and even knowing that you engaged the community. Actually, that's what made a difference, I believe. It's not something that was imposed by the government. You used the youth, you worked with the local women groups to help them share the message, because they're the people that are in the grassroots. And coming to Aminata, to Narind, I also really have heard about this herbal remedy for as long as COVID started making rounds in different countries. And I remember there was a theory, or maybe there was a rumor out there that Tanzania, the president of Tanzania, might have gotten the herbal remedy from Madagascar. And as many of us know, Tanzania has not had huge periods of lockdowns as we did in other parts of the country. So I echo Philippe's observations, Philippe's comments that herbal remedies do really help. So before I close, I mean, that's just to comment. It's not necessarily a question. Just before I finish my comments, I want to ask generally everybody in the forum, do people have any other theories that they've had? It's not necessarily something that they know has worked. Are there any other theories that are trying to explain how Africa is either managing or actually not experiencing the greatest impact as other countries have? So what are the other theories out there that you've had, perhaps? I'm trying to make people talk, actually. I'm not seeing many people. I'm just trying to make it.
Okay. I was going to talk, but I already talked. So since you
No,
want,
that's good. That's good.
actually my hand was, I put my hand up again. Let me just say, first of all, people are not giving us enough credit for actually wearing the mask and the social distancing. A lot of countries are doing that. People are doing that responsibly. It's difficult in certain places over others. If you go to the bigger cities in Nigeria, Lagos with 20 million people, but most cities are not like that. They're not that crowded. And in many places they have rules where people go to work maybe 3 times a week. That is happening. So people need, some credit needs to be given to a lot of these countries. It's just that people don't think of responsibility and discipline when they think of the African continent. The other thing is immunity. Immunity for me is a big part of it. There are ways I lived growing up. I didn't live in the gutter or anything like that, but you go out there and you don't completely just isolate yourself in fear. You go out and deal with your environment, and that created a lot of immunity. And I believe a lot of Africans have some form of, a lot of good, strong immunity without any medical proof. I'm not a medical person, but I honestly believe that because of my growing up experience. And so I think that's one of it. In answer to your question, at least partly, Damaris. The other thing I want to say is that when we talk about traditional medicine, it's something that comes with responsibility. Wherever the traditional medicine is in Madagascar or Nigeria, in certain places where it is being used and trusted, it comes from a long history of developing these and learning and researching these herbs. People don't just go and pick them up. It comes from a long history handed down through generations. My fear is that we're increasingly ignoring them. And the more we ignore them, those who have the secrets, who have the knowledge, many of them are dying with the knowledge. That is my only fear. But I honestly think a lot of us in various parts of the continent have done a good job in social distancing, physical distancing, whatever we call it, wearing masks. But I also strongly believe that immunity is on our side. I think a lot of us, not that we're immune to the virus, but that we have built up immune systems that can fight it. At least that's what I believe.
I agree with you, Philip. I've heard many people talk about immunity as well. Those are the few theories, as I call them, that I've heard people say, and I do believe as well. It's not to say that we're immune to everything, but somehow, because we don't have a proof, we don't have an explanation yet. As I said, I know many countries are doing their best. Senegal leading the way, I think, according to the news out there. But I think, as you said, all the African countries are trying, and immunity part of it. And some people actually have said, could it be the climate? I don't know.
Yeah.
I've heard that as well. Could it be the tropical climates or stuff like that? I don't know. We're only just happy that it's not affecting us as much.
And I think with regards to the theory of the climate and immunity, it's quite surprising how from the onset of the pandemic, people kind of opposed that so strongly. I mean, these theories didn't come up after the situation we are seeing in Africa, where the disease couldn't have a strong feet. It actually started right from the beginning. Before we got to this point, people kept saying that this thing cannot survive in Africa because of the fact that we have stronger immune systems, because we keep getting sick, and so our immune system is always at work. And people said, no, that's not true. We don't have any evidence. People said that the virus cannot survive in the hot climate. They said no, and here we are. So, I mean, it still comes back to the political space that Africa finds itself. I see a few hands up. Maybe I'll go to Emmanuel.
Hi, everybody. Thanks for the two presentation. I think I'm gonna just share, like, from my perspective, why Africa is not that really great impact. I mean, the COVID hasn't had a great impact in Africa. And I think one of the major reasons I think about that, it's maybe due to the youthful population. So majority of the population in Africa, it's youthful. And as you've seen the epidemiology of this COVID-19, it tends to affect people with older age and so forth and so on. And also, not so many Africans have these underlying conditions like, when I was studying in the University of Nairobi, we usually used to call them this diabetes and cancer, lifestyle diseases. So those are also one of the reasons, among the reasons why I think the COVID-19 has not had that a lot of impact in Africa. And also from Narindra's presentation on the herbal medicine for the diseases, and then I saw, like, towards the end, she posted a question: why are we not using the traditional medicine to treat diseases, even like this COVID-19? And I tend to differ with that because, like, I know, coming from the synthetic chemist perspective, being a synthetic chemistry, and also having had a presentation here and there from people mostly in biotechnology, biology, I think all these medicines that are sold in the pharmacy, they were either, inspired by nature or just synthesis from nature. So usually, most of them are derived from traditional, mostly from Chinese traditional medicine. So I think we have the traditional medicine even in the pharmacy. It's only that now they've been regarded as, I would say, modern medicine. And partly because if you look at the traditional medicines, most of them come from plants and sometimes animals. And if we were to, like, just treat people from those plants, again, speaking from environmental perspective, then we'll have to cut down a lot of trees, and that will not have good impact in the environment. So usually people go and look, for instance, somebody has talked about the neem tree. So they look at the neem tree and then, like, identify what exactly in that neem tree is capable of treating certain diseases. And then they go and carry out synthesis, and then, like, they make it chemically such that to avoid the cutting down of trees. So I think we are using mostly traditional medicine. It's only that it's not called traditional medicine. Yeah. So that's all I have.
That is a very good
Yeah,
point.
good point. Yeah, go ahead.
I was just going to say that that's a very good point. Yeah, that's actually that is correct. But it's like, how? So should we call all medicine traditional medicine, or should we change the name of what we call now as traditional medicine as unprocessed medicine, and then the one that we have from the pharmacy, maybe you call them, they are still traditional, but they are more processed, and yeah. So I think that was interesting. Thank you for the comments.
Yeah. And maybe to add to that, it's also important to note that there is also always the political economy aspect of the discussion, because I agree with Emmanuel, and that's true, as Narindra said, that traditional medicine is not necessarily too different from orthodox medicine. But the point is, at the end of the day, it's someone who is doing that synthesis. It's someone who is who has the lab and what it takes to make to synthesize what it is that we find in plants, versus someone else who would have to go and cut trees and make medicines out of. So we can't take away that political economy discussion, because whether traditional, what we call traditional medicine, will be more popular than orthodox medicine depends on who is using what or who is producing which of them, and what's the power dynamics in there. The pharmaceutical companies, who are they? Where are they from? Which countries are they from? Those people that would do the traditional medicine, raw traditional medicine from plants or animals, where are they? Which countries are they from? So we can also take that away from the discussion.
Ebenezer, I'm glad that you mentioned the pharmaceutical companies. I think those are probably the main players against the traditional medicine, because it's about business. So yeah, I'm glad that you brought that one up. So usually people will tend to shy away. They will tend to advise people against traditional medicine so that people can buy this orthodox medicine, and that's also business.
Yeah, so sorry to just jump in here. Thank you, Emmanuel. I think let's remember also just generally what we're told, the stigmas that come with traditional. Generally, when we even talk about societies, oh, this one lives in traditional society, unsophisticated, not very smart. That one lives in the city or in the urban society. So these things, these words have effects on us. But the point you made, Emmanuel, which I think ties in with Ebenezer's point, the kinds of research we associate with these big pharmaceutical companies. Remember, one thing I think we should remember is that the reason why it seems as if there's no research around quote unquote traditional medicine is because it's neglected. You pay attention to it, you develop it. You don't pay attention to it, it's neglected. And then there's no research around it because it's a process. Wherever people have gotten to in Madagascar with traditional medicine is a process. They've got to that point. Now we can move forward, develop further. But if you neglect it, you don't pay attention to it, then those so-called research doesn't take place. And at the end of the day, like Emmanuel has pointed out, you know what the prices are with these pharmaceutical companies. When I was cured of measles, it's palm wine that was used. I think I mentioned this in another meeting that some of you might have been at that meeting. It's palm wine. Palm wine grows behind our compounds. What does it take? It's not going to cost you anything. Now, I have nothing against the United Nations, but they'll come up with this policy about this is how to cure measles. By the time you write proposal, there's this, that, millions of dollars of ESTA code or whatever, and then logistics. We're looking at, then you can't afford the drug anymore. Palm wine grows, and the good thing about palm wine is after using it as medicine, you can drink it. If you drink alcohol, you can also enjoy drinking it. There are various kinds. So it serves on several levels. You can enjoy it on several levels. My mother even used palm wine to bake bread because there's yeast in palm wine. So we have a lot, but I don't think we trust ourselves. And if you don't mind my just saying this, let me match the whole issue around medicine or traditional medicine with say what our mechanics do. I believe in Ghana, for instance, this probably happens in Nigeria. Have you ever looked at a car that's a write-off in the United States and said, oh, wow, if this was in Nigeria, they would fix this car? There's a lot of talent. What I'm doing is now comparing to establish the fact that there's so much talent, but there has to be an enabling environment to develop it. And we need to trust ourselves. So whether it's in the medical field, whether it's in technical field, fixing cars, I've seen expertise that unfortunately will probably just waste away because it's not recognized or it's not developed.
Yeah.
Great points there.
Can I add something to it? Yes,
sure.
I completely agree with Philip Lader's point on research. Actually, in Africa, we are not really investing enough in research, in all type of research, especially in medical research. The COVID, when I give the COVID organisms, actually we have the, how do you call it, the Artemesia, we have that in Senegal. And there is a researcher, he's even the head of not head of the Department uh, the pharmaceutical department at UK at the University of Cheikh Anta Diop, and he's been all along saying that we have some natural traditional remedies that we can use to fight a lot of disease. But unfortunately, you know, the pharmaceutical industry is one of the most powerful. There's a lobby behind. If you remember, it was a battle before we had Africa. They can grant Africa the generic and so what do you call it again? Getting tired right now. The medicine against HIV. It was a lot of fight because they decided, okay, you can now have access to generic medicine because it was less cheaper. This is the same thing. So another point that it's not about we don't trust in ourselves. It's just that our government has really to foster the sovereignty. And I was saying in my presentation at the end, we need to rely more on our local products. And just because I work in the agricultural sector in terms of policy, how we inform agricultural and rural development policy, how we inform them by evidence. And then I went to Poitiers in France, and I saw on a farm sorghum. You know, sorghum is a kind of millet here in Senegal, Burkina, in Mali. It's kind of red, and they were growing those in that field, a big farm. And later on, this guy, he gonna go and find a patent for the sorghum, and we won't get access to that. Meanwhile, in Senegal, we're not even using that sorghum anymore, and this is one of the richest cereal ever. But because there's a neglect, as you said, of the government, but just we are not putting enough money in investing in research, right? And we need to change that. I don't know, maybe another talk would be around how to really boost and invest in research in Africa. Mostly invest from Africa. East Africa, they're very advanced. Kenya, you're doing wonderful stuff, really, in the environment, in the agriculture, really, in Ghana and Nigeria, South Africa. But most of the Francophone country, we are just led by, you know, the French corporate and other European industry that are controlling actually our economy and our health, by the way. Thanks.
Interesting points there. Anne, I see your hand up. Did you want to?
Sorry if I seem to be dominating, but this idea of what we're discussing today really excites me. And I have been studying it. So now I just want to discuss about my positionality as this woman who is situated in what we in Kenya call the diaspora, and the privilege I have when I start embracing the so-called traditional medicine, because I'm not read as being backwards or practicing witchcraft. I've got an access to all these Africans. I have Nigerian friends, friends from Senegal, African-American friends, the Caribbean, South Africa, who teach me the ways of traditional medicine. I learned from the African Americans about the oils here, and South African women about how to center yourself around your ancestors if you're to deal with traditional medicine. So if you come to my house, I'm always, I use traditional medicine a lot, the oils and all that, because I have to be well, right? So because I'm in the West, I'm privileged to be like that. If I was living in Kenya, I'd have been read differently, considering I'm a woman, I have no children, I have not married, and then I have all these herbs around me. You know, I would be very suspicious. Yeah. So then, academically, I decided I just want to learn about traditional medicine, especially from my community. So I found a professor in Kenya who, in academia, when people study herbs, they call themselves ethnobotanists. And he does very interesting research. And I work with him because I'm interested in adult learning. So he was looking at how children, women, men in my community, how they just learn about whatever is in the community, how it's medicine, what part is it, what part is useful, what do they use it for? And it was a very good experiment that we did together. He done first, and eventually we wrote a chapter on it that I also got to learn a lot about traditional medicine. So where I'm going to is that we as Africans who are in the diaspora, we are very lucky if we awaken to this knowledge that we have. We can learn a lot, even more than people who are close to, you think they're in the village and close to their grandmothers and grandfathers. We have the privilege of really learning a lot from all these transnational Africans or the diasporic Africans. Yep.
Great, good points there. Thank you very much for sharing, and don't worry for sharing too much. We are here to learn. So um, if there are still questions, please keep them coming. And while I wait to see more hands up, I actually have one question that maybe will take us away a bit from the current topic of discussion, but still within what we are talking about for today. And it has to do with the measures that have been put in place so far. So Aminata and Narindra, and I saw some aspects of that coming in, especially with Aminata's presentation. So besides the wash hands, wear mask, social distance measures that we hear of all over the place, and how we Africanized some of them, washing of hands, how we Africanized it. Besides those ones, do you know of any locally grown measures that were important for our specific context in the fight against COVID? For example, in Ghana, I know that because of the way the virus moves around and the fact that our economies are mostly cash economies and we carry a lot of cash around, in order to encourage people to stop using too much cash during the difficult times, I remember the Bank of Ghana decided to scrap off the charges that we pay on mobile money services up to a certain limit to encourage people to use mobile money services more and stop using cash. So I'm wondering if there were such measures, such locally grown measures within African countries. So maybe Aminata and Narindra will take it first, and if people know of such measures from other countries and would be happy to share them, we would appreciate them.
Okay. I think besides said the fact of even in Senegal, still many people actually doesn't believe even in this COVID until now. But regarding what are the other strategies that we will have deployed to fight the spread of the coronavirus, service delivery, in particular food delivery, was really, it became actually a booming service. It started, but now, and the offices, the public offices, the private business, people were just using food delivery. And then we don't use it, you know, Senegal in Ghana, most of the African, we have the same pattern. We use, we exchange cash. So, and we, rather this time we were using our mobile money. I think Senegal, if you look at the statistics, one of the country where the mobile money is one of the most advanced actually business here in Senegal, and people have access everywhere, even the shop at the corner of the street, they can go and then get access to money. So these two combined, the service delivery combined with mobile money, has helped a lot. Another thing also that we have seen is, you know, the social gathering, it is very important during like the family events, wedding, naming ceremonies also. And we offer that these are the spreaders of the disease. So what the government really will policing this seriously this time. No big social gathering, and then it worked. So far. So this is the two, and another one is people were doing alternative. They will alternate eating in the offices. But like in my office, maybe I shared the office with my another researcher. So what we do, like I would come 2 days during the week, and then the other 2 days he will come, and it worked also. People would they will reducing, the human contact. So this is the three main really things, and then prayers. People were saying prayers have saved Senegal more than anything, everything, the church, the mosque, everyone were praying, and we're organizing special prayers for that. And then this is maybe another perception of that we need to pray, otherwise it's going to be a catastrophe. So this is really, maybe it worked. I don't know. I prayed myself. I think everyone prayed. Every morning I pray, please God, I don't want to catch this disease. And because I was really going on the field meeting people, I wore mask, but still I was at a high risk because I was not really being confined at home. I was on the field.
I think spirituality is important, but I mean, this is the way I look at it. No matter how much you pray to pass an exam, you still need to study. So there has to be responsible behavior along with spirituality.
Yeah, I agree with that. So that's a good question. I'm trying to think of other ways that people have been adjusting with the COVID. So I just from the news and the media, the I've saw I've seen some reports on like the increase of use of bicycles in the city, because there was during the high spike in cases of COVID, the 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 government stopped all the transportation modes on all buses, and only the people who are like essential workers can drive their own car. And then so people who needed to get outside of their house to find food and things like that, they usually use bikes. So I think that was interesting. And this one may be related to the traditional one, but infusion has been a very common thing uh, since COVID in Madagascar. So people will collect any aromatic plants, and then they boil it, and then they do some infusion with it. So I think that was interesting. Yeah, and most of the measures are already mentioned by Dr. Aminata.
All right. Thank you for sharing that. I see Ant's hand up. And do you want to share something?
Yeah. Sorry for appearing to be like this overzealous student, but there are two things that I think started happening in Kenya. The so-called African sauna, which is almost like inhalation, where people boil some, you know, eucalyptus leaves and neem leaves, and then they have Vicks, and then they inhale to just clear their cardiovascular system. So that was going on a lot. We take a lot of tea, so people are taking more tea with ginger. Then there's when our country opened up after a lockdown, they people started moving to rural areas. Usually, people move from urban spaces to from rural spaces to urban centers. Now there's people coming back to villages. So at first, the villagers did not like them because they're like, oh, they have COVID-19, they're gonna bring it to us. Yeah, so, but then eventually people have settled in, and yeah, families are no longer, I'm told people are less in Nairobi now. Families, uh, are what most mothers and the children are in the village because our schools, the students are not going to school unless they're taking exam. We are switching our education system. So children who are maybe 9 to 10 years old, I'm not very clear, I need to ask because I have a niece that age, they're the only ones who are returning to school. So the ones who are writing the exams to go to level 5, the ones in level 8 wanting to go to high school, and the ones who are finishing high school, and the ones who are joining the university for the first time are the ones who are back on campus. Some university students are on campus, yeah. So so the city, there are less people. The kids can be in the village until schools open again. So yeah, for once we've seen that happening. And then what you're starting to see is people now going back to practice agriculture. Yeah. So our Minister of Agriculture is encouraging young people especially, and many families to have the kitchen garden. So in the 70s and 80s, we had kitchen gardens. We didn't go to the market to buy vegetables and everything. You always had the kitchen gardens. So now we're having that. It's the return of kitchen gardens. So there's something good coming out of COVID-19 along discourses of food security here, and just decongesting cities, because Nairobi was a city. It's a big city, but there are like 4 million people there, and some of them live in abject poverty. It's one space where there's Kenya, and generally Nairobi, it's one space on earth where you see the disparities. They're very palpable, so yeah, so now, yeah, and then there's therefore a glut of apartments, because there are all these nice apartments in Nairobi which are very expensive. Now there's no one to live there. Yeah, so there's all this new phenomena that maybe someone should study. Someone who does urban studies should look at that.
I think the internet is hanging on Eben. Yeah, but we can continue the discussion as he gets his way back. We have about 7 minutes, and I don't know if people have any more comments, any more questions to the speakers, or general questions to the audience.
I have a question for Aminata, and correct me if I didn't get this right, but I think in your presentation, you said part of the problem is Senegal relies quite a bit on foreign food imports. Did you say that?
Yeah.
I'm just curious to know why.
Correct.
I'm curious to know why. Why there's that dependence?
Yes, first, yeah, I think it started with the colonization period. When we were doing our the farming mostly for subsistence, and then when the French came in, they said, okay, we're gonna have to do how they call it, commercial agriculture, like peanuts, and mostly peanuts. And Senegal is a small country, so we don't have huge, vast land, agricultural land, say in Ghana or in Kenya. So land is very reduced, and then and people early on, with the drought in the mid 70s and late 70s, many rural people trying pouring in the capital city, Dakar, so neglecting agriculture. And agriculture was not really, the government didn't foresee that the agriculture is one of the sector that will lift us up, that will make us a developed country, because all countries that are now developed, they start with agriculture, then they mechanized agriculture. They build their industry based on that, and so on, so on. So we completely neglected this sector. And now, and we also, we adopt, and then we starting adopting the lifestyle of the French. Like, we want to eat bread, and we don't have the what is the cereal we're gonna make bread of, wheat. So we consume Dakar. We consume a lot of wheat bread, and then we don't produce that. So this is one of the first the product that we import. We consume a lot of rice, and we don't produce enough. This is now is the last 5 years that we're trying now to develop the rice, local rice. So we import most of the rice from Asia, China, Indonesia, and Malaysia. So wheat and rice, most basic, this is our food. We have our produce and meat also, and chicken. And we didn't actually develop those sectors. That's why now we really depend on imported food. And as I said, Senegal people, we travel a lot. When we come back, we start adopting lifestyle from the United States, from France, and we kind of eating the same food. Now in Senegal, we have KFC, we have all of this big brand now, and then we more and more eating what we're not producing. So this is the basic explanation. And plus, just we didn't have solid policy and program that would really boost our agriculture. But things are getting now better. They're fixing things. Young people, as Anne was saying, they're going back to the rural area because they know now agriculture is the key. Yeah.
Ebenezer, are you back? Looks.
Yes, I'm here now.
Okay.
All right. So I think we have just a few minutes to hit the top of the hour. So just in order for us to respect everybody's time, I think I will at this point thank our presenters so much for their time and the knowledge that they've shared with us. It's been a very great learning discussion today. Narindra from Madagascar and Aminata from Senegal. Thank you so much for your time, especially Aminata. We know it's very late in Senegal and you still made it to be with us. We very much appreciate that. So at this point, I think I will invite Damaris and Sarah for any housekeeping announcement that they will have for the audience, so that if anybody wants to leave when it's top of the hour, they can leave, and then the conversation can continue if people are still here.
All right. Thank you so much, Ebenezer, for the facilitation, for the discussion as well. I want to thank the presenters again. Wonderful job, wonderful discussions and insights in regard to the COVID-19 situations, especially in regard to the resources and remedies. Thank you so much, Narindra and Aminata. So at this point, I want to welcome my colleague, Dr. Kalumbu Isaac. If you can share about the annual report. I tried to find it in the website, so I don't want to make that announcement if it hasn't been posted yet. So you might be able to give us some light about the African Studies Center annual report.
Yes, Damaris, thank you very much. Thanks, everyone. It's wonderful to see the support that the Tea Time is getting. And thank you so much to Aminata and Niang for speaking to us from Senegal. That's really special that we get to be spoiled. And thank you, Narindra, for leading your talk on Madagascar. I'm sorry I missed both talks because I was in another meeting that continued until 4:30, when it was 5:30, sorry, when it was meant to finish at 4. But these things happen. So we have a really great report that's coming out tomorrow of the African Studies Center. It is really just a report on all the activities of the center since 2019 up to 2020. and it's really exciting. Please look out for it tomorrow. It's going to be on the website, and I think you're going to also get something in your email encouraging you to go check it out. It covers a whole gamut of activities, and I think you will be proud of it. So we really want to encourage you and your friends to look at it, and we are going to put it on Facebook and on Twitter. We'll put links, Instagram. Please repost and retweet and everything. We want to reach as many people as we can all across the world, not just here in the United States, in Africa particularly. Please do so. And we invite you to take a look at that. Next week, we will be rolling out the film, the documentary that was done for the Year of Global Africa. We are also in talks with WKAR to broadcast that film. So it's all very exciting stuff that's happening. And we thank you for your support, and we hope that you're going to look at that report and share it with many, many other people. Our aim and our hope is that it is spread all across the world so that people know what the African Studies Center here at Michigan State University is doing in promoting African studies in Africa, here in the States, and on the globe. Thank you.
All right, guys, thank you very much for hosting me, and I'm gonna have to leave now. Bye-bye.
Thank you, bye-bye.
Bye-bye. Thank you very much, Aminata.
Thank you very much. Yeah, have a good evening.
Bye.
All right, Dr. Damaris, you're muted.
Okay, thank you so much for letting me know. So I was just making one more quick announcement about the next African Tea Time sessions that we're going to have, the very last one this fall semester. And the first one is on November 5, and it's going to focus on Tanzania and Egypt. And we're going to discuss the inequalities in education as a result of COVID-19. And then the next Thursday, which is November 12th, we're also going to have a tea time focusing on Nigeria and Zambia. And it's about the food security. And I remember it came up in our discussion today, especially when Aminata was discussing some of the effects that COVID has caused. So on the 12th, we're going to delve more into that. Those will be consecutive Thursdays. That's why I just wanted to mention, so then you're not confused that we're going to have them in 2 weeks apart. So it's going to be 5th and 12th, just because of Thanksgiving. Other than that, I don't really think I have anything else except thanking everyone for staying with us until the end. And we look forward to seeing you back on November 5th. Thank you.
Thank you. Have a good evening, everybody. It's been great. Thank you.
Thank you.
Thanks, everyone, for coming.
Yeah.
Thank you.
Bye.